Well, we're joined now by our In Focus health correspondent, Linord Moudou.
Hello, Ndimiake.
Now, Linord, you're about to tell us something. I have a cell phone, Makori, you,
I
everybody I know, and yet they're dangerous?
Well, I will tell you all about that. But first, we'll talk about motherhood. It is a positive experience for many women, but for others, it involves suffering and even death. UNICEF reports that in sub-Saharan Africa, women face a 1 in 13 chance of dying during childbirth, as compared to a 1 in 4 chance in industrialized countries. Dr. Hanuni Sogora is with Zanzibar's Ministry of Health. She says one of the reasons for the high rate of maternal mortality in our country is the lack of use of family planning services.
It has been a very big challenge for us in Zanzibar to start with family planning. As I said, we started in 1985, and our main challenges is maternal mortality is very high. This is due to low utilization of the services. Like most of our women, they don't deliver in the hospital. They deliver at home, about 50%. And users of family planning is very low, it's only 9%. This has been contributed by, of course, cultural issues. Most of the women of the community, they don't know the relationship between using family planning and reduction of maternal health and for the health of women, of the children, and of the family at large. So the challenges we are facing that the misconception of religion with family planning concept. We have used this, we've utilized the religious leaders, sending them to study tours to countries like Indonesia, Egypt, Tunisia, where family planning has been well accepted. And when they come back, we use them as a resource person to educate the community on the concept of family planning and religion.
We turn now to mobile phone or cell phones. They have changed many lives for the better. They enhance personal security, quicken emergency response, and give people the ease of instant communication. But the electromagnetic radiation that they emit could be placing people at risk for brain tumors. Here's a story.
They are the symbols of our time. Cell phones. From Europe to Africa to Asia to the Middle East, 4 billion people use them worldwide.
It is very important to have a phone because, hold on. Hello?
In this Chinese film, aptly titled Cell Phone, a man's life is destroyed by his cell phone when he forgets it at home. His wife discovers it and his affair with a younger woman. A Senate hearing recently didn't deal with people's private life. International researchers and U.S. lawmakers looked at whether radiation emitted from cell phones will kill you. They did agree that some studies have linked heavy, long-term cell phone use to cancer of the brain. Physician Sigal Sadetsky advises Israel's health ministry.
I believe that cell phone technology, which has many advantages, is here to stay. The question that needs to be answered is not whether we should use cell phones, but how we should use them.
Health warnings to cell phone users have been issued by governments of several countries. Dr. Linda Edrich represents the $4 trillion wireless industry. She says there's no need for concern.
The current evidence does not demonstrate that phones cause cancer or other adverse health effects.
But Teresa Gregorio's experience raises questions. She says she used the cell phone beginning in the mid-1990s, even giving up her landline. Bad news came in 2008. She has an inoperable brain tumor.
I had used a cell phone for 2 to 3 hours a day, right here on my right side, right where my tumor was or is.
270 million people in America use cell phones. 70% of teens or preteens have them. Younger children are even more vulnerable.
Radiation gets much more deeply into the head of a 5-year-old or a 3-year-old than it does into that of an adult.
Epidemiologist Deborah Lee Davis says children, because they have thinner skulls, are more at risk.
The science needs more work, but I want to ask, are we really prepared to risk our children's brains till we find out for sure whether or not this is a hazard?
Although results of studies on a cancer link are contradictory, scientists are urging consumers to be safe rather than sorry. The idea is to keep the phone away from the body. Use earphones or a headset. Keep your phone on your belt, not in your pocket. Texting is better. It keeps the radiation down on the phone further away from you. Senator Tom Harkin chaired the hearing. He says he's just beginning to ask questions.
I'm reminded of this nation's experience with cigarettes. Decades passed between the first warnings about smoking tobacco and the final definitive conclusion that cigarettes cause lung cancer.
Linord Moudou, VOA News.
And for more news from Africa and around the world, go to voanews.com.
Well, thank you so much, Linord, for joining us.
Sure.
And I'm going to put my phone somewhere. I don't know. I'll figure it out.
Away from your ears.
But of course, please remember to always join Linord Moudou right here on In Focus every Tuesday and Thursday. She'll always have the latest health news.